hard to believe that we've been doing these briefings since March. The region has been leading the community through the pandemic while keeping quality essential services like transit, paramedic services, clean water, senior services, public health, and garbage collection, to name a few. Our media partners have been very supportive in communicating the important pandemic updates to the community. Going forward, we will be expanding our focus to give you news and updates from regional government and our community partners' response to the pandemic. After all, the pandemic response is about a community of people and not just the numbers. We're working hard to support vulnerable citizens, families struggling to balance work and school-aged children, businesses who are doing everything they can to follow public health guidelines and stay in business, and frontline workers who need support. Everyone is impacted by COVID-19. Today, in addition to Dr. Wang's weekly update, we welcome Hsiu-Li Fairclough to our panel, President of St. Mary's General Hospital and Regional Lead for Hospital Response and Testing. We're lucky to have Dr. Wang as our Chief Medical Officer of Health, and she's tirelessly protecting our community through this pandemic. I am pleased to announce that the Ministry of Health has officially recognized Dr. Hsiu-Li Wang as our Permanent Medical Officer of Health. Regional Council appointed her Commissioner of Public Health and Emergency Services in July of this year, followed by an application to the Minister of Health to make it official. Dr. Hsiu-Li Wang is well known and highly respected in this community, especially for her exceptional work in safeguarding the health of our residents during COVID-19 pandemic. We've heard Dr. Wang's concerns about continued increase in cases and outbreaks in Waterloo Region. And I want to emphasize that our numbers now indicate we're moving to the red level of the province's COVID-19 response framework. This will move us from orange or restrict level to the red control level. I've been in contact again this week with Minister Elliott's office to stress our support for the province to move Waterloo Region into this level quickly, and understand it is likely to come into effect Monday, November the 23rd, but we await confirmation from the province on this change today and whether it may come in fact sooner than Monday. Under the advice of Public Health, Regional Council, as the Board of Health, is supportive of moving into this next level as a way to be even more proactive in dealing with the increasing COVID-19 spread in our community. As we learn more about these new measures and changes that are required for Waterloo Regional businesses, we will work with Public Health and Best Waterloo Region to get the information to those impacted by the changes as soon as possible. The increase in COVID-19 cases also emphasizes even more need for contact tracing. On behalf of Regional Council earlier this week, I made an urgent request to both the provincial and federal government for an increase in trained contact tracers and investigators to support our efforts. With each case and outbreak, we are seeing very high numbers of contacts that require hours of contact tracing by public health officials. It is getting more and more difficult for public health to reach everyone who has potentially come in contact with a person who later tests positive for the virus. Already this week, Dr. Wang has received a commitment of 10 more contact tracers of whom we are external support. We can't do this alone. We need all levels of government's assistance to increase our contact tracing capacity. This also highlights the need for more education and stronger enforcement. We knew the second wave was progressing, so we reached out early to the province for help. Earlier this week, and for the next few weeks, a provincial multi-ministry team of almost 30 provincial offences officers has been dispatched across the region to carry out education and enforcement of high-risk businesses where we see spread and where we see people letting down their guard. This supports our own current efforts to build awareness and ensure workplaces stay safe and stay open. We've seen too many outbreaks in employee settings where COVID-19 is spreading from one worker to another, as Dr. Wang has illustrated in her comments previously. Enforcement locally is a four-pronged approach that includes public health, regional enforcement, local area municipal enforcement, as well as the Waterloo Regional Police. With regard to enforcement, for the period of November 12th to 18th, regional bylaw and public health inspectors responded to 136 calls or emails and made 28 site visits. A summons was issued on November the 10th at Ming's Restaurant in Cambridge. The charge was for failing to ensure patrons seated at different tables were separated by distance or an impermeable barrier. The provincial multi-ministry teams have conducted 212 site visits. Contraventions were found in 57 settings, but these were related to the new requirements under the Reopening Ontario Act related to the provincial framework. No charges have been laid at this time. We continue to urge stronger compliance by workplaces to enforce the requirements of wearing masks, socially distancing where possible, hand washing, and staying home with any symptoms. As Chair of Public Health, I have instructed staff to increase our enforcement efforts and to use the tools available to enforce, including the Reopening of Ontario Act and our regional mask bylaw. I would now like to turn it over to Dr. Wang. Dr. Wang?
Thank you, Chair Redman, and thank you everyone for the opportunity to provide you an update this morning. So regarding overall trends, although in the last couple of days, our daily numbers of new cases reported has come down a little, which is good to see, we are still firmly overall in the red category. And there is already broad spread of COVID-19 in our community. There are currently 349 active cases of COVID-19 in the region, surpassing our highest reported caseload from the spring. We have met the updated thresholds overall for the indicators outlined under the red control category of the provincial framework. Our current weekly incidence rate is 60 cases per 100,000 per week. Our current percent positivity, taking into account interim data, is 3.3%. Our reproductive rate has fluctuated between 1.1 and 1.5 over the past week. The 1.1 is what you will see in today's update. We have experienced some larger scale outbreaks as well, particularly in workplace and business settings. In the past week, our ability to contact cases within 24 hours has dropped to as low as 50% over a 3-day moving average. But this is temporary as we continue to reallocate and reinforce our staffing. Our team has indicated we should be back up to 90% of cases in the next day or two. Following Chair Redman's request to the province, they have indicated to me they will be providing us with additional staff for case and contact management starting next week. We currently have over 90 staff and students allocated to case, contact, and outbreak management. That includes the 25 school nurses. The province will be providing approximately 10 additional staff, which will bring our complement to a little over 100. We've also introduced efficiencies, such as having the schools send out information to the families of children in the cohorts who have been dismissed, so that families will receive in a timely manner the same information our nurses would have provided them over the phone, and our nurses will follow up with them later. Regarding hospital and ICU capacity, I'll just say a couple of words, but Hsiu-Li can speak to that much better than I. Hospitals due to COVID-19 are increasing, and our hospitals will be at risk of being overwhelmed if this growth in hospitalizations continues. The decision to move a region is made by the provincial cabinet and is done so in consultation with local municipal leaders such as Chair Redman and myself as the Medical Officer of Health. Given the recent acceleration in growth, which has led to multiple outbreaks, broad community spread, and a weekly incidence rate behind only Peel, Toronto, and York, the three areas of the province with the highest incidence rates, I have advocated to the province that Waterloo Region be placed in the red control category. COVID-19 spreads easily when you have close, unprotected contact. That means it is spreading in settings where face coverings are not worn or taken off, and or physical distance is not practiced. This is happening in social gatherings between friends and family, and it's also happening in workplace settings and sports and recreation settings when these measures are not practiced diligently. At Public Health, we are monitoring, we begin monitoring, in fact, and investigating settings as soon as a single case is identified. We do not wait for transmission to occur before we begin to monitor for potential outbreaks. As an example, we not only have 13 active workplace, facility, and business outbreaks, we have an additional 56 of these settings that we are currently investigating and monitoring to prevent a single case from spreading or to contain spread that has already occurred to the extent possible. I will give you some more statistics. From the period of September the 1st to November the 11th, we have managed close to 4,600 high-risk contacts. 179 workplaces have been followed up and monitored. There have been 73 instances of schools, daycares, before and after school programs, and post-secondary institutions being followed up and monitored. And there have been 186 instances of follow-up and monitoring of long-term care and retirement and congregate care settings. All of this work is done to prevent and minimize both the number and the spread of outbreaks. With all of the settings that are open right now, this is why case and contact follow-up has become much more labor and resource intensive, as well as complex. So as a reminder, each time we are in close contact without physical distancing or wearing a face covering, each time that is an opportunity for COVID-19 to spread. Regarding the provincial framework and the categories under this framework, we recommend that businesses make plans for each level of the framework. We expect to hear more about all the levels later today from the province in terms of their thresholds and the restrictions under each category. If Waterloo Region is moved into the red control category, some of the significant changes we anticipate are, based on the current requirements under these categories, limits for indoor public events would decrease to 10 people, previously 50, and outdoor public events would decrease to 25 people, previously 100. These limits, 10 people indoors, 25 outdoors, would also apply to restaurants, sports and recreational facilities, event spaces, retail, and other settings. Cinema, excluding drive-ins, would be closed, and performing arts facilities would be closed to spectators. All measures for each previous level would still be required in the red control category, such as required screening of patrons. In closing, at this time, when the circulation of COVID-19 has never been higher in Waterloo Region, I continue to urge for the time being that all residents only leave home for essential purposes, such as going to work, going to school, going for groceries or takeout, going for medical appointments, and exercising, preferably outdoors. Please avoid any social gatherings with friends, co-workers, and extended family. This includes birthday parties, sleepovers, play dates, coffee dates, game nights, and dinner parties. Please avoid any of that. Please limit your social interactions to only your household members, which can include 1 or 2 essential caregivers or supports for someone who is living alone. We have seen how fast this virus can spread. We need everyone's help to dramatically reduce our social interactions. Doing so will significantly reduce our risk of having to move beyond red and can potentially shorten the time we would otherwise need to stay in red. Finally, I know this is tiring. We all want to get back to normal, but COVID-19 doesn't tire. So we need to do this to not only avoid longer and more severe restrictions, but to be able to start lifting restrictions as soon as we can. We did this earlier this fall. We can do it again. Let's protect one another and our loved ones. Please support one another during these difficult times. We are stronger together. Thank you.
Thank you, Dr. Wang. Lee, over to you.
Thank you, Chair Redman. And I do just want to start by congratulating Dr. Wang on her formal appointment. Having the opportunity to work so closely with her through this, I can tell you she has an unbelievably tireless commitment to supporting this community. So thank you for that, and congratulations. It's very well deserved. Given the signal that Dr. Wang has given our community today, clearly our health system is taking the rise in cases that we're seeing very seriously. Our goal as a health system continues to be to maintain services as much as possible. However, this is, and certainly will be, further tested with further rise in cases. Hospitals have seen a rapid increase in hospitalizations this last week. As example, last weekend, from Friday morning to Sunday morning, cases rose from 3 COVID positive admissions to 20. At St. Mary's Hospital, for example, we had 11 admissions for COVID-19, which surpassed a trigger for us to adjust our operation to support COVID cases, reorganizing our spaces in the hospital, and assessing all of our services. We have been fortunate that we've been supported to increase our bed capacity and had support for supplies, including PPE, to be as best positioned as we can so that we can respond. Though we have expanded our ability to care for patients and worked really closely across all the hospitals in our region to be sure that we maximize the use of every bed in every hospital, our inpatient occupancy at hospitals has recently continued to be very high. Now, the reasons for that are multifold. One is it's the typical seasonal pressures. The second is that we've seen an increase in the need for acute care services after wave 1. Thirdly, we have been working really hard to address the backlog in surgeries and procedures that came from wave 1. And then now we are seeing care, we are needing to care for COVID positive patients. Yesterday, the province also announced that there are 150 patients, we are over the 150 patients that are admitted to ICU beds in Ontario. Though currently we are in good shape in our region to respond to ICU needs for people in our region and have a healthy supply of ventilators should we need them, this indicator is an important one to monitor should we as hospitals need to support others from other regions across the province. For these reasons, hospitals will be very actively managing our situation. We may need to reduce services, including scheduled procedures, particularly if we find ourselves with heavy occupancy and increased admissions. In addition, and this is probably the most important risk that we worry about, is that our staff will be exposed to COVID in the community or become high-risk contacts of people in the community, which will limit their ability to come to the hospital to provide care. Our goal is to maintain services, definitely any urgent and emergent services, but we want to provide the much needed care that people have been waiting for since wave 1 and meet the increased needs that we have seen. But we are already at the point where some small numbers of service adjustments may need to be implemented. And we're also trying to balance the risk of being overwhelmed suddenly. We have seen this in neighboring regions and neighboring hospitals. It happened very quickly once they reached a certain amount of community spread. And so we want to manage the risk that we will not be in a similar situation. We also continue to manage our testing and labs very closely, making sure that we can have rapid turnaround times and ensuring people are able to access testing in a timely way. And finally, we continue to support as much as feasible care partners visiting with patients. This may be an aspect that may need to be adjusted with further spread, but we want to ensure that people continue to have that access. So this is where I need to ask your help for our health system. If our healthcare team members in hospitals, but also those that provide home care, long-term care, primary care, mental health care, and other services in the community get exposed to or develop COVID-19, they can't provide much needed COVID or non-COVID related care. All of these services are necessary to provide quality care to people, but they also support the protection of acute care hospital resources. The measures described by Dr. Wang that we need as a community, they help us to do that. We know that it's been long and tiring. Our team, I have to tell you, is also feeling weary too, from the increased infection control requirements, supporting new services and new processes for care partners in the hospital. But we need to muster the energy to push through this now to help protect each other, but also protect our healthcare system. Importantly, all of our hospitals and service providers are collaborating so that we can support the pressure in any service changes that may be required. We will do all we can to be prepared and to respond and provide care, but you are our first line of defense for our health system. Wave 1, we saw your support for our frontline workers as they provided support to you. And your actions, both your public health actions and your tremendous generosity, lifted their spirits as they came in to do that. Please, I just ask that we try to do that again. Thanks very much.
Thank you so much, Lee. We'll now turn to our media questions. Lauren, do you have a question? Lauren, you're on mute.
All right, thank you. I wanted to know a little bit more about the contact tracing efforts that I know have been recently increased. Can you tell me a little bit more about how that process is working so far?
Yeah, so we have been usually able to maintain, the benchmarks of being able to reach cases within 24 hours. We've been performing well on that in general. But after Dr. Hsiu-Li gave an update last week, and since then, we've had a decrease in our ability to meet that benchmark. But it's on a temporary basis. That can happen sometimes when there's a large influx of cases, especially if there's a large number of cases that have come in, which has been the case in the last week approximately. But we have been since the start of the fall actively bringing on more staff and training more staff, and we have currently a little more than 90 for case contact and outbreak investigation, and we're going to continue our own efforts to bring on to bring on skilled staff, trained staff, because there are many aspects of case and contact and an outbreak investigation that require trained staff. In addition, the ministry, following Chair Redman's request to the province, has committed to provide us around 10 additional skilled and trained case and contact staff. And so that will push our complement of staff to a little over 100, which will be good. We expect that very shortly we'll be able to, again, reach our benchmarks. So that's also why we have implemented, some measures that are more efficient. So, for example, if a cohort in a class has been dismissed, in order to be able to get the information to parents quickly without delay, we're having the school board send them the same information in written format that our nurses would have told them over the phone in contacting them. Our nurses will still follow up with them, but a little later. And so this will ensure that they get that information. And we also, just really ask everyone, generally people are able to check for their results online. Please check for your results. They're also told, when they're tested, if they have symptoms, if they've been a close contact, they need to self-isolate. So we're really asking people also to do whatever they can just to make sure that they follow the guidance that's been given to them when they go get tested, for example, or if they're having symptoms. We want them to go get tested. If they have symptoms, if they've been a close contact, they should self-isolate immediately. Public health will reach them, but they should start with those things immediately.
Lauren, do you have a supplemental question?
Yeah, and just to follow up, earlier this week you mentioned that testing facilities were still at capacity. I'm wondering if that is still the case?
Yeah, sorry, Lauren. What I mentioned was that they were not at capacity. Sorry. What I meant was.
Sorry, yes. That they still have capacity is what I intended to say.
That's right. And you know what? I'll pass that over to Lee.
That's accurate, that we, there is still some capacity available. And then I would just also say we manage this pretty closely so that if we needed to expand capacity, then we will be prepared to do so.
Okay. Nicole, do you have a question?
Hi, good morning, Dr. Wang. Last week when we were shifted into the orange zone, many people were wondering why we weren't immediately put into the red because our case counts were already higher. Could we potentially see Waterloo Region skip the red and go into gray? Like, are we close to the parameters met under the lockdown zone, the gray zone?
Yeah, no, thanks for the question. So the parameters actually haven't been set yet for the gray or lockdown zone. I anticipate that we may see that information later today by the province because they said they were going to work on that and provide an update. I don't anticipate that. I anticipate that we will be moved into the red zone because that's what our indicators overall are showing. And we also have to give the measures in the red zone some time to be able to take effect. But the reason that we're moving from orange to red relatively quickly is because our measures warrant it. Sorry, our indicators warrant those measures.
Nicole, do you have a supplemental?
Yes, I wanted to see if you can provide any further details in regards to the staff testing positive at Centennial. We had heard some information earlier this week that they were awaiting a test result while they were in the school setting. So, are we expected to see any potential cases there? And could the staff, if investigated, be potentially fined under the Reopening Act because it is a workplace setting?
So I am not able to give patient specifics for patient confidentiality reasons, but I can confirm that yes, the staff person was in the school setting during their infectious period, and therefore the number of classes that were dismissed were the number that public health felt needed to be dismissed based on our assessment. And we understand also the school board is looking into the circumstances of this incident, and they would be the ones to follow up regarding that.
Okay, Timothy, do you have a question?
Yes, I do. Just give me one moment. Just taking a look at what public health is seeing, what does the second wave differ from the first, whether it be more cases, lack of compliance? How do they differ in from what the public health has seen so far?
Yeah, so that's a good question, Tim. So in the first wave, it was very dominated by outbreaks in long-term care homes, and then unfortunately, many severe illnesses and many deaths. So we know that's what happens when COVID is in an environment where there's many vulnerable people. It can spread very quickly. What's different about wave 2? I would say there are a few things. One, we are detecting a lot of cases among young people. It's mostly people that are in the younger to middle-aged adult age groups. And there is, as a second item, there is a lot of spread that's happening in either social gatherings or in workplace or business settings. And that's often due to people not, practicing the recommended or required measures actually in a workplace regarding physical distancing and masking. That is driving a lot of the spread. So you may have noticed, there are relatively few outbreaks in long-term care home, retirement homes now. As I mentioned earlier, there's a lot of work behind the scenes to try to prevent that. And I think homes overall are also better prepared. We also have a lot more system supports for them than we did in the first wave. But so overall, things are not like in the first wave so far. So I would say, so that's the second thing, that there's been a lot of spread in social gatherings and in workplace and business settings due to oftentimes, people not following guidance, either due to employee spread or patron to patron spread. That's been the most likely scenarios. And then overall, I think the thing that the third point I would just mention, and I'll leave it at that, is because it's affected a lot of people that are younger, and oftentimes it doesn't lead to severe health impacts, I think there is a perception that it's not as dangerous. But I think that's not the right assessment, because when there's this much spread, it will affect the more vulnerable populations. We have already started seeing that now with the increase in hospitalizations. It will eventually impact more care homes, regardless of all of the measures that we've put in place. It will affect healthcare providers because they are also often in those age groups. It will affect our overall ability as a community to be able to, do the necessary hospital and healthcare procedures, be able to keep things running. It will and it can very rapidly have significant overall community impacts. So I would just say that that's why it's really important to do the things that we would like people to do now, which is limit their social interactions. And also we do have to put limits now on openings in various business settings in order to reduce those social interactions. It's very, very important because we cannot let this community spread continue to increase at the rate that we've seen it increase.
Tim, do you have a supplemental question?
I do. I just wanted to ask about nurses and doctors. I know right now bed capacity in ICUs are somewhat okay, but if that continued to go up, what if, is it possible that the region could possibly make restrictions specifically for nurses and doctors so they don't get sick, because we're going to need them no matter what?
I don't know, Lee, do you want to take this?
Yeah, well, I'm not sure the types of restrictions you're referring to. I think, you know, no matter what, we've got to try to do our best to make sure that nurses and doctors are staying well and they're staying protected where they are. I think that in the first wave, we did have some examples where if it was a very dire situation and somebody was a contact but could be protected, that they might be allowed to work. But I just don't believe that's a preferable approach. I don't think it's where we need to start. I think we need to start with protecting our healthcare workers, and doing that means limiting community spread so that they're not exposed when they're out doing the essential things that they need to do. Does that address your question, Tim?
Yeah, I just wanted to make sure that nurses and doctors stay safe, because I've heard in London that there has been an outbreak in a nurse setting as well. And so I just didn't know if maybe the hospitals or public health might make restrictions for specifically nurses and doctors so they can stay safe within the community.
Can I say something? Tim, we can put in all the restrictions possible to try to protect essential workers or vulnerable people, but that's not going to protect them unless we reduce overall community spread. Mm-hmm. You can't isolate certain groups of people from being infected beyond a certain point. Everything now really depends on our level of community spread. Mm-hmm. The more that's high, the more those doctors and nurses and the more those patients in long-term care, for example, will be affected.
Okay. Damon, do you have a question?
So my first question is for Dr. Wang. I was just looking for some updates on the kitchen cuttings outbreak. I know they were closed for a couple of days and they've reported several cases. So I was wondering if there was any link to community transmission.
Yeah, so this was an outbreak where we identified cases, but that aren't linked to a risk at the restaurant setting itself. And so it's similar to other circumstances where, you know, when there's a cluster of cases, public health is going to be following up directly with those cases to try to minimize the potential for further spread.
And could you put a number quantity to that?
It's very fluid. Every time we call up a case, we could have more contacts. So the best way to really monitor is to monitor the numbers on our dashboard every day. That would be the most up-to-date numbers that we would have for you know, numbers of cases related to a setting.
Okay, and then in your opening statement, you mentioned like we need to avoid birthday parties, coffee dates, and all these. Are those things we're seeing reported through contact tracing still in the past couple of weeks?
Yeah, I would say that social interactions are still things that we're hearing about, but it's not just here; it's everywhere in the province. So I think there's a bit of a sense that it's okay, and you know, people may still be confused about that. This is why I wanted to make it really clear what I mean by social gatherings. It's all those types of things. We cannot do those things right now. Please help us. Please don't do those things. That's often how these things are spread.
Okay, Irene, do you have a question?
Yes, we've heard that restaurants could start checking ID to allow only local patrons into their establishments. Is that something that's been discussed, or is that just a rumor, or is there more information on that?
There are some restaurants I heard through the news that are implementing that as a policy. We're not mandating that in the region. I don't see how we can mandate a restaurant to do that. How would they have the ability to prove that someone isn't from the region? But what I have and continue to advocate is, again, that people that are in areas of high transmission, not go to areas that have lower transmission. Although that said, now we are a region with higher transmission. So overall, the message is, please do not go out unless it's for essential reasons. And please do not visit, including for our residents, please do not visit areas of lower transmission.
Irene, do you have a supplemental?
No, that's it. Thank you.
Thank you. Joanna?
Yes, thank you. Just wondering when we'll find out about whether we're moving to red or not.
This afternoon.
Yeah, my understanding is there's a press conference at 3:30, Joanna. I don't know if that's when it will be announced.
Okay. And Dr. Wang, you talked about all the work going on behind the scenes to manage or prevent outbreaks. Do you think that the public has faith in your department's ability to manage this situation? And I'm not criticizing you, but I'm just saying, like, do we have enough resources? Do we have the people to do this?
Mm-hmm. Yeah, no, we've been able to do this well to date, and I wanted people to be aware because I think it's important for them to be aware of the whole situation. We have struggled in the past week, but we've put in place measures, and we're continuing to put in place measures, and we should be able to reach our benchmarks again soon. But this is part of the picture, in terms of when you have widespread. It's like if you're in a hospital, you have a certain number of doctors and nurses. Even if you open up beds, you need doctors and nurses. You can't, if you're doubling your numbers every week, you can't double the number of staff you have every week. But that said, we are doing everything we can to control the spread, but we definitely need the cooperation of everyone in our community. That they can play an important role. And I think Lee had something she wanted to say, so I'll pass it over to her.
Okay, go ahead, Lee.
I was just going to add, I think as well, when it comes to managing specific outbreaks, particularly in long-term care home, retirement homes, or congregate settings, that is also where our pandemic triad sort of kicks in, and we come together as health system partners to support that organization in working through the outbreak. So, I think that there are certainly Hsiu-Li and her team do phenomenal work to be managing the public health components. But when it comes to actually supporting organizations or long-term care homes and dealing with those situations, many health system partners step forward to assist with that. I just wanted to add that.
Lee, can you just remind everybody who the triad is?
Yeah, sorry, the triad is our COVID pandemic response triad for the Waterloo-Wellington area, and it's myself as the hospital lead, Dr. Sharon Ball, who is our non-hospital lead and works very closely with primary care in the community, and of course, Dr. Hsiu-Li Wang from public health.
Joanna, do you have a supplemental?
No, thank you.
Thank you. Joe, do you have a question?
Hi, yes, I do. First of all, I want to say congratulations to Dr. Wang on promotion. That's excellent news. Thank you. I have a question concerning daily care. So if a person with COVID-19 goes into the ICU for treatment, what happens? What kind of care do they get?
So is that a Lee question?
Probably, if Lee's okay with taking that one, or
I could answer it, but I would much rather you talk to one of our intensivists about that question, because I'm certainly not an ICU doctor. But I think that the care for patients with COVID-19 has evolved. We've been learning as we've been going through it. So certainly, they'll come into our care in the similar way somebody will come into our care in the ICU. Everybody is under protection that's involved in the care of that patient. And I would just say the evidence changes. It's been changing since March until now for what's the best way to manage people when they're in our ICUs. That's the best I can do as a non-intensive care doctor, but certainly we're happy to follow up with you if you need it.
Joe, do you have a supplemental question?
Yeah, actually, the supplemental question was, and maybe someone in intensive care could answer this as well, but what does it feel like to have COVID? I mean, the message has been, and it's been a great messaging of washing your hands, physical distancing, your bubbles, and so on. I'm wondering, this is a supplement to the supplement, if explaining to people, like, first of all, what does it feel like to have COVID? And is it time to start getting that message out?
Joe, sorry.
Go ahead, Lee.
I think that that's a really important question, Joe. And we certainly do have people who will tell their story and have told their story. And, I think it's one thing to go through the treatment itself. It's another thing to recover after you've had the treatment. And, when we see sort of long periods where people are affected, and the rehab needed to recover after ICU care for COVID is also very significant. So I'll take you up on that offer. I think we need to find people that can speak with the media and be sure that their story is told. I certainly have talked to people that I've worked with who's been affected by COVID, both in the hospital and in long-term care. And the effects are significant, and I think it's important for people to know that.
Thank you.
Okay, that's great. So halfway through this, all my squares changed. I think I got to everybody. Both Lee and Hsiu-Li have places they have to go. Does anyone have a burning remaining question? Nicole?
I'm just wondering if any of you, Chair Redman, Dr. Wang, or Lee, things seem different compared to the first wave. In the first wave, we saw community support, people going out, banging their pots, driving to hospitals, honking their horns. We're not seeing that sort of same support this time around. Is there any way that you would recommend the community show their support this time around? Because it's like right now, the case rates are worse. We're in a worse situation than the first wave, but we don't have the same sort of feeling of hope out there. So wondering if you guys can provide any suggestions that you'd like from the community.
So Nicole, I'm going to start off, and you'll probably get much better responses from both Lee and Hsiu-Li. I would say follow public health guidelines. That is the best thing. I keep thinking of Tom Hanks when he came through having COVID and said, literally, wearing a mask is the least you can do. We're really hoping that providing community responses regularly will give people confidence that there is a raft of professional people, whether it's paramedics, firefighters, the police, social workers, housing people, that are all working at making sure we're all supported through this. But there is no doubt there is pandemic fatigue. I don't know. Hsiu-Li, do you want to go next?
Yeah, I would just, that's a great point, Chair Redman, and actually it answers a little bit Joanna's question as well, in that, I think we have very good professional resources that are working on various aspects of COVID, whether it's public health response, hospital response, primary care response, paramedic response, first responders response, et cetera. So, but we can't do it alone. We need the community's help, because the drivers behind the spread are mostly in the hands of our community members, right? We are seeing spread due to less adherence to the recommended measures. And I think what I would really like to say is that I can understand if people thought this wasn't as serious because younger people were getting infected, but we've seen in places like Toronto and Peel, and now we're starting to see this here, just how much quick and widespread community transmission can have significant impacts throughout our entire community. So that is why it is so important to start at the root and minimize those non-essential social interactions so that we don't continue to fuel the spread of COVID in our community. That's all I'll say.
Lee, go ahead.
I agree with the comments of my colleagues here wholeheartedly. I mean, the one thing that I would say is that I can tell you firsthand, there's nothing that feels actually more hurtful to a healthcare worker when they've come back to work after a weekend and somebody 2 doors down has held a big party, when they have spent the weekend at the hospital caring for people with COVID. I know myself, I really felt this in the first wave when we were still managing things in long-term care, and we started to see this kind of behavior, and it's extended, and you can't help but feel that it feels disrespectful for those that are trying to really help to care for people and to provide the best care that they can. So, Nicole, I think that's one, is it just really thinking about that. In the moment that you decide to go and have that social interaction, there is somebody at the hospital caring for somebody with COVID in that moment. So how do we show respect for those frontline workers? And then the second thing I would say is, I think that all of us also recognize what a challenge it has been for everyone and the toll it's taken on people's mental health. And we want to keep those services there and we want to support people. But we also need to instill a sense of hope. And that hope is going to come from coming together as a community. And so I think that's the best way that you could show your support, and that community spirit that we certainly saw in wave 1.
Anybody else with one burning question? That's a great question, Nicole. And Lee and Hsiu-Li, you can see why this region is in such good hands.
I do. It's Joe.
Okay, Joe, what's your question?
Want to squeak this in. So November 6th, Public Health confirmed there was a staff member at Mary Johnston Public School in Waterloo that tested positive for COVID-19. And at the time, parents were told there were no high-risk contacts and no one was going to have to self-isolate. So we got word that parents received an email yesterday that Public Health collected new information related to the case. And as a result, a cohort has to self-isolate, which means that cohort initially remained in school. And that was 2 weeks ago after being exposed. I'm just wondering if you can confirm the incident and provide any other details.
Yes, Joe, thanks. Yeah, those things can happen. Hopefully they'll be rare. But we received additional information last night that we didn't have previously. And so that's why we felt that it was important, even if, there was just 1 day left of the period, the 14-day period, to inform parents. And our nurses will be following up with those parents to assess how their children have been. I suspect the risk in this case, as has been in many cases or most cases in our school settings, is low. But we have a very conservative approach with school settings, and so that's why we dismissed the class and we'll be following up with them shortly.
Okay, thank you all very much. Lee, I know you wedged us in between 2 other really important pieces of work. And Hsiu-Li, thank you for making yourself available. And to all our trusted media partners, thank you very much for carrying this message to the community. It's an important one. Stay well.
Thank you.
Thank you very much, everyone.
Take care.
Good day.